So with this next talk, we're going to talk a little bit more about comprehensive behavioral intervention for tics. We're going to talk about a little bit more about what it is exactly and how it works. So before I start with that, a little bit about me. I graduated from University of Southern California with a master's in occupational therapy. I completed the CBIT course in 2021 and received my certification early this year. I have experience as an occupational therapist in neurology, sensory processing, and feeding. And I am, as Jeff said, one of the two occupational therapists in the integrated Tic Clinic here at Children's Hospital Colorado. So some objectives for today. Hopefully by the end of this talk, you'll be able to learn the rationale behind CBIT treatments, name the two overarching components of CBIT and what goes into each component, learn a little bit more about who is appropriate for CBIT, and learn about the effectiveness of CBIT. So before I get going talking about CBIT, I know Chelsea mentioned this a little bit too, but I think this is an important distinction to make. CBT versus CBIT. We have seen kids in clinic who say, well, I've tried CBIT and I didn't think it was particularly helpful. And when we got to asking questions, it turned out that it was actually CBT or cognitive behavioral therapy. So I wanted to kind of point this out to show the differences as well. So what is cognitive behavioral therapy? Well, it's a type of treatment utilized by mental health professionals, psychologists, social workers. It's used for a variety of disorders. There's some listed here, such as anxiety, depression, addiction, eating disorders, and many more. And as Chelsea mentioned, it's focused on changing thinking and behavioral patterns. This is in comparison to comprehensive behavioral intervention for tics, which is a treatment that is developed for tic disorders and Tourette syndrome. It does draw on some cognitive behavioral therapy principles, but it has many other components as well. So for the sake of this talk, I'm going to be referring to comprehensive behavioral interventions for tics as CBIT. All right, so treatment for Tourette syndrome and tic disorders, well, it's not needed in all cases. If we have some mild cases, if your tics don't interfere too much in your day-to-day living, day-to-day life, then maybe you don't really see the need to pursue treatment, and that's okay. The Tourette Association of America has outlined 3 overarching treatments for Tourette syndrome and tic disorders. One of them, Chelsea discussed briefly, which is medications and pharmacology. The other one is what I'm going to talk a little bit more about today, is CBIT. And the last one we won't talk about today. It is used in very rare situations, but that is deep brain stimulation. All right, an overview of CBIT. Well, there has been over 40 years of behavioral intervention for Tourette syndrome and tic disorders in the research. And finally, but there's nothing really systemic, any sort of treatment that was designed particularly for this population. So finally in 2001, the Tourette Association of America and the Behavior Sciences Consortium came together and they developed CBIT. It was developed for children and adults ages 9 years and above. The goal of CBIT is to learn effective tic management skills. The goal is not to cure Tourette syndrome. And the general structure is 8 60 to 90 minute sessions over 10 weeks, and then you can do booster sessions as needed. So what is the rationale for CBIT? What do we know about tic disorders and Tourette syndrome that is the foundation of this treatment? Well, as Chelsea mentioned, we know that tics are neurological in nature. We know that these are not things that you're necessarily doing on purpose. But we also know that tics are highly impacted by internal and external environmental factors. We know that tics wax and wane, and we know that they are preceded by an uncomfortable feeling or premonitory urge. And the last thing we know is that tics, this premonitory urge and tic cycle can actually create a negative reinforcement cycle. So let's take a look at that. What is this negative reinforcement cycle of tics that we see? Well, most tics, you have a premonitory urge, a sensation, a tingling, an itch, any sort of kind of something that doesn't feel right that precedes the tic. Usually it's found in the region of the tic. So once we feel that urge, then we know that we need to tick to get that relief. So we have this cycle where the relief in and of itself actually reinforces the tick. So that's that negative reinforcement. So when CBIT was developed, the idea was, where do we focus in this cycle to do an intervention? And the idea is that if we can focus on this premonitory urge and prevent this subsequent cycle from happening, then we can help better manage your tics. So this slide is just kind of an overarching slide to show all the components that go into CBIT, and I will go into each one in future slides. But there are two major components of CBIT. One of them is habit reversal training. That includes awareness training, selecting your competing response, and identifying a social support person. The other component is function-based intervention. So that is where we look at the environmental impacts on your tics. And in doing this, we look at the ABCs of behavior, and we also have identified some relaxation training that can help manage your tics as well. So let's get into this. The first part of habit reversal training is awareness training. So each week, you will identify a tic for that session. So you focus on one tic per session. And in the session, once the tic has been identified, you really practice that tic repeatedly with your CBIT therapist. And that is so that you start to learn all the body parts and systems involved in your tic. In what order do they occur? Start to recognize that premonitory urge if you're not already recognizing it, and where it is exactly. From there, you do some exercises where you start to signal, usually it's like raising your finger, when the tic just happened, or ideally, when it's about to occur, when you feel that premonitory urge. So all of this is very important because, as you can imagine, you need to know your tic, what the urge feels like, in order to do the subsequent steps of habit reversal training. So sometimes, you know, tics don't necessarily happen every hour. So if that's the case with a tic we're working on, we might even choose some activities to trigger your tic. So if we know that the tics happen while you're playing video games, for example, we might incorporate some video games in sessions so that we can do some of this habit reversal training. The next component, once you've got that awareness and you're about 80% in being able to detect when it's about to happen or when it's just happened, that's when we go into this competing response training. So the competing response is an action that we do once we feel that urge that helps eliminate the tic from happening or prevent the tic from happening. So there are 3 rules outlined in CBIT to help select a competing response. The first rule, and you'll see this in a video coming up as well, the first rule is it has to be physically incompatible to the tic, which means that it has to prevent the tic from happening. The second rule is it has to be less noticeable than the tic. This is usually the case, it's not always the case. And the last one is it has to be held for 1 minute, and it has to be able to be done anywhere. So once we kind of talk about what we think would be a suitable competing response, we might try it out, we might practice it, see if it truly does prevent the tic from happening. And if that's the case, then we will, again, do things to trigger the tic to practice the use of the competing response in session. So this is taken from the CBIT guide, which I'll show you a little bit later. These are just some common tics you might see and some suitable competing responses. So for example, if we have a facial grimace tic, we might choose to purse our lips as a competing response. If we have a head jerk tic, we might tense our neck muscles or lower our chin. Any sort of wrist movement tic, we might put our hands on our legs, maybe even squeeze if we feel like it's necessary. Leg lifts, we might push our heels into the floor. Tongue clicking, you might want to push your tongue to the roof of your mouth, or maybe do some controlled breathing. And with phonic tics, we will want to do some controlled breathing. So this is where we really want to kind of focus on what is the breathing pattern of the phonic tic, because the breathing pattern of the competing response should be the opposite. These are just some examples. They should be taken with a grain of salt, because really part of the competing response training in CBIT is following the rules and your child learning to do, come up with their own competing response on their own. But there are some, suggested options available if needed. All right, so I'm going to show a video of what the competing response selection looks like. In this video, you actually see the therapist is Douglas Woods, who is one of the founders of CBIT. So let's take a look.
Ty, you did a great job coming up with the definition and description of your head jerking tic, okay? But what we're going to do now is to try to teach you an exercise that will help you stop that tic, all right? Because ultimately the goal is to try to get a little bit of control over that head jerking tic. So what I'd like to do is to come up with an exercise that you can do that will help you control the tic. And the exercise that you choose has to meet 3 rules, okay? The first rule is that any exercise that you choose has to prevent the tic from happening, or at least make the tic harder to do, all right? The second rule is that the exercise that you choose has to be less noticeable than the tic, right? So it can't be as obvious as the tic. And the third rule is that you have to be able to do that exercise anywhere at any time for a minute or until that urge goes away.
Okay.
Okay. So again, the 3 rules: it prevents the tic from happening, or makes that head jerking tic harder to do.
Okay.
It's not as noticeable as the head jerking tic, and the exercise you choose can be done anywhere, and it can be done for a minute or until the urge goes away.
Okay.
Whichever takes longer. So if you think about your head jerking tic, can you think of an exercise that might meet those 3 rules?
Maybe like holding my head like this.
Okay, so let's think about that. So if you hold your head like that, let's see if it meets the first rule. Can you hold your head like that and still do your head jerking tic?
A little bit.
Okay, so it might not meet that rule. What's more noticeable, the head jerking tic or you going like that?
Me going like this.
Maybe it depends, because a head jerking tic can be kind of noticeable. Can you do that anywhere?
That's kind of where I might be noticeable. Like in the mall, if I'm just walking around and going like this.
Yeah, that might look kind of strange. Or what if you're, pitching in a baseball game?
Yeah.
That might be a problem, right? Okay. Or you're holding your bat, you're up to bat.
Yeah.
That might be a problem too if you jump up to do it. Okay. So that one has some problems maybe.
Yeah.
Okay. One of the things we commonly do when we have a kid with a neck jerking tic is we teach them to do this. We have them drop their chin a little bit and hold the sides of their neck tightly, not with their hands, but just to tense their neck slightly. Not too much, but just tense their neck just a little bit, right? So not too tight. So once you do that, okay, let me check your neck. Okay, is it really tight? Okay, good. Just a little bit tight and hold your neck down. Okay, and so once you do that, if you hold that position, can you throw your neck back or not?
Not really.
Okay. What do you think's more noticeable, your head jerking or what you're doing right there?
My head jerking.
Right. Okay. So now can you pretty much do that anywhere?
Yeah.
So can you hold that for a minute?
Yeah.
Okay. If it's too tight, if you're holding it too tight, then don't do that, because we don't want you to be able to hold it.
So what I really like about this video is, I'm guessing this is probably session 1 or session 2 of CBIT, but you notice that Douglas gives the child the tools he needs to determine these things on his own. And that's really the idea of CBIT. It's not that you need a CBIT provider at all times with all tics. It's that at the beginning, we'll scaffold it, so we might be a little bit more hands-on, and then by the end, we're really taking a step back and allowing the child to lead the intervention.
How are you getting?
All right, so the last part of habit reversal training is an important part, because as you can imagine, 1 hour a week with a CBIT provider is not enough to see any sort of improvement with tic severity. So identifying a social support person is a big component of this. That's usually a caregiver or a parent or anyone who lives with the child. The support person's job is to keep the child or your child accountable. And the idea of this is that you need to overlap, meaning spend time with each other for about 30-minute segments, at least 4 days per week. It doesn't mean that you have to kind of sit and just talk about your tics for 30 minutes, but you can overlap, for example, at the dinner table or while watching TV at night. The idea of the social support person is to really keep your child accountable for doing their competing response exercises. So, and really, you'll work more with this with your CBIT provider too. The idea is to keep it really light and positive, and not make it negative or like a punishment or scolding or anything like that. So really reinforce your child for using these competing response exercises. Hey, nice job doing your exercise just there. If you see that they're forgetting to do their competing responses, that's when you might remind them in a positive way. Don't forget to do the competing responses. And the idea of the social support person is really to be a coach and kind of, like I said, keep things positive. All right, so that was habit reversal training. That's one of the components of CBIT. The next component is this function-based intervention. And in this component, what we do is we learn how the environment is impacting your child's tics. We also start to identify strategies or changes to lessen the environment's impacts on your child's tics. And we might even choose some proactive strategies to manage tics in high impact places. So an example of this would be like, if I know that I tic a lot in Walmart, then I might do my competing response before I even sense the premonitory urge. Maybe do it in a systematic way. So every time I turn down a new aisle in Walmart, I'm going into this competing response. And that can help manage your tics as well. So when we look at the environmental impact of tics on tics, I like to use this ABCs of behavior model, which is a behavioral model used beyond tics, but in this case, it's been adapted to tics. The ABCs of behavior being that the antecedent is the A, what happens before or what may trigger the behavior. The behavior, the B in this case, is the tic itself. And the consequence, C, is what happens after, reactions that may reinforce the tic. So these are some examples of antecedents and consequences that have been identified for tic disorders and Tourette syndromes that can reinforce tics. So some antecedents, we have loneliness, stress, anticipation, such as anticipation of social events, fear or boredom. If you notice, all of those are internal states. Also, some things like sedentary activities like watching TV, video games, returning to school, loss of sleep. Then if we look at consequences, some consequences that have been identified include just the relief in and of itself, like we discussed, being aware of being observed, if you know people are watching you while you're ticking, escapism, as Chelsea mentioned, so being able to leave class, being able to stop doing homework because of your tics, receiving attention. So that can be either positive or negative attention, whether that's being told to stop, people laughing at you, people staring at you, or even being comforted because of your tics. All of this can reinforce your tics. And the last one is being asked to leave, which can happen frequently at school. So these are just some examples. They're not going to happen. Every child, every tic is different. So really part of this component of CBIT is sitting down with your CBIT therapist and identifying what factors really impact you or your child's tics. All right, so then once we've identified environmental impacts of our tics, there is some relaxation training that is worked into CBIT. There are 2 exercises in particular that have been identified that you practice with your CBIT therapist. One of them is diaphragmatic breathing, and the other one is progressive muscle relaxation. So diaphragmatic breathing is that slow, deep breathing from your diaphragm, and the progressive muscle relaxation is where you tense and release groups of muscles for a period of time. These can be used as part of your intervention for the functional intervention. So for example, if I have more tics when I'm anticipating a big event like a play or something like that, then I might go into my diaphragmatic breathing before the play to help manage my tics a little bit better. Progressive muscle relaxation can be really helpful for bedtime, to help get ready for falling asleep and help manage tics in that way as well. So studies have shown that these exercises, when used within the CBIT treatments, can actually help decrease tic severity over time. When used alone outside of CBIT, they don't show any changes on tic management. And this last bullet point I had to include because I'm an occupational therapist, and what we tend to do as occupational therapists is really do like sensory regulation curriculums as well. And these work really nicely in here in the function-based intervention. There are studies that show that the alert program, which is, how does your engine run? Too fast, too slow, just right. That using that with patients with tic disorders can actually help decrease tic severity. And then there's this other program that I really recommend you guys check out. It's called the Leaky Brakes program. It is like a regulatory program that was designed specifically for people with tic disorders and Tourette syndrome. And that, I believe, is from the Ontario CPRI. So check that out as well. But these are both things that we integrate into our functional intervention if needed. All right, so now that we've gone through all the components of CBIT, let's take a look at what a typical session might look like. This can vary provider to provider, but this is just kind of a general idea. The first thing that we might do is check in with our social support for the week, talk to the child as well. So how did this last week go? How did it go doing your exercises? Where did you find that you were able to catch it and do your exercises? Where do you feel like it was challenging? Do you feel like the competing response was helpful? Do we need to make any changes, etc.? So from there, each week and each session, you fill out a form. That's the tic hierarchy and distress scale. And that is essentially how bothersome are your tics that week. So each week you give it a numerical rating. This is really to help track, to see how our tics are doing, but also to help identify, you gave this tic an 8, maybe this is a good tic to focus on this week, 8 out of 10. So that is usually towards the beginning of the session. From there, once you identify your tic, you go right into the habit reversal training of the new tic awareness training, selecting the competing response. Then you go into the functional intervention for that tic. Where are you noticing you're doing it? What can we do about it? And then the homework will typically look like that social support, so really overlapping with your social support person that week, and also identifying some changes you want to do with that functional intervention. Like I mentioned, the Walmart thing. So, okay, maybe every time I go into Walmart, I can go into my competing response every time I go down a new aisle or something like that. So because I'm a visual person, I kind of wanted to lay this out. I know it's not the most normal of frequencies, but sample CBIT timeframe. As you can see, the first 6 sessions are weekly, and then the last 2 sessions are spaced out every other week. The rationale behind this is because, like I said earlier, the idea is that your child is slowly getting more and more independent in tic management as we go through CBIT. So by session 6, 7, 8, really your child's taking the reins in terms of how they're going to select the competing response, what functional interventions they're going to do, so that, when we're done with CBIT, should new tics occur, or maybe your child has more than 8 tics, they have the skills needed to proceed to manage their tics as they go on. In this case, I did throw an example booster session 9 on about 3 months out, and that is, you can do that as needed if you feel like you want to touch base, if you feel like I can't really think of a good competing response for this tic, etc. So there's a lot of flexibility here. You don't necessarily need to stick to this time frame, but this is the one that was outlined by the people who developed CBIT. All right, some important notes about CBIT. CBIT is not suppression. So suppression is often tedious, and as Chelsea mentioned, can lead to just needing to let go of tics later. As part of the competing response, remember, we're looking for something that is physically incompatible to the tic. So we're actually intervening to prevent the tic from happening. Another important note is it's not linked to the development of new tics. The competing response has not been shown in any research to then turn into a new tic, if that makes sense. It is highly recommended to treat or control any comorbidities before starting as best you can. we know that there are like anxiety symptoms can exacerbate tics. So really coming at it from a, getting that CBT if needed or anything like that to help support any comorbidities is important. It does, and this is why it does take a lot of effort at first. I mean, your child may tic. Do you have any tic that can happen hourly? So imagine if you have a certain tic 4 times an hour going into that competing response throughout the entire day. So the idea of CBIT is that we're trying to do our exercises all day long, and then that social support overlap is really just there to keep us accountable. So it does take a lot of effort at first, but it should get a little bit easier with practice. And like I said, it does teach independence and tic management. So the idea is that you don't need a CBIT therapist in the future, and the timeline is flexible depending on each person. So if you only have 4 tics, maybe you don't need all 8 sessions at first, for example. All right, so how effective is CBIT? Well, the research shows that about 52.5% of children had significantly improved tic symptoms with CBIT. As Chelsea mentioned, this is about the same rate, if not better, than medication, with, of course, less side effects. The research does show that these children who did show improvements sustain that improvement over 6 months in about 87% of cases. So we know that it can help improve tic severity, and that improvement is sustained over time. And the last thing I wanted to point out, because there still aren't that many CBIT providers out there yet, the research shows that it's just as effective over telehealth. I personally have done it over telehealth, and I actually think out of everything that we've all had to do over telehealth recently, it lends itself very nicely to a telehealth model. I think there's benefits to being in your house, in fact, where you might be able to access some of these things that trigger your tics a little bit easier. So if you don't live nearby a CBIT provider, don't worry, because it is very effective over telehealth. So am I appropriate for CBIT? Well, like I said, we recommend to treat and control your comorbidities first. The research does show that untreated ADHD can show worse outcomes with CBIT. And the last bullet I think is really important. Your child's interest matters here. So if you as a caregiver really want your child to learn tic management, but your child doesn't care, then it's not going to be super effective. And there's nothing wrong with not caring. But really, if your child takes the initiative and wants to work on their tics or learn how to manage their tics, then they're going to be more appropriate for CBIT. All right, I did want to include this bullet point because, as I mentioned, CBIT was developed for children and adults ages 9 and above, but a lot of the Tourette diagnoses happen younger. So what about those kids? Well, there is CBIT Junior in development for children ages 5 to 8 years. It's a little bit different from regular CBIT in that there's a greater emphasis on parent psychoeducation. I believe the first entire session is just with the parents, not with the child yet, because really at this age, the parents are going to be key for success. There are some changes in the session structure. So I believe part of that competing response training, they have different cards of different movements your body can do. So for example, a head jerk, and the child it's kind of like a game, come up with the opposite movement of this, just to kind of gauge their readiness to do CBIT. And the exciting news is that the pilot study shows significant decrease in tic severity. So stay tuned. Hopefully this will be out soon. All right, Chelsea kind of talked a lot about this. I'm sure Kristen will talk a lot about this as well, but this is how can I help manage my child's tics? I think it's important to find a neurologist to follow your child for routine visits, especially if they're on medications, to see if any changes are necessary, if any further support is necessary. Find a specialist to support any comorbidities. So maybe find that counselor or psychologist who does cognitive behavioral therapy. Maybe seek an occupational therapist for ADHD concerns, etc. Here I put if appropriate, because again, it depends on how motivated your child is, or if your child wants to pursue CBIT, then that is definitely recommended to find a CBIT provider. Consider the ABCs as a parent. What am I doing that can be reinforcing my child's tics? And again, if you do pursue CBIT, you will go into this with your provider in great detail. This bullet I think is really important, especially for the Tourette syndrome population. Support your child's self-advocacy. I think the best thing they can do is learn to feel comfortable to talk about their diagnosis, talk about, you know, I can't control this. The best thing you can do is just to ignore this, talk about it with their peers, with their educators, with people, anyone who asks. Talk with school about getting an IEP or a 504 accommodations if necessary, really to help your child excel academically. And then Tourette.org has so many great resources and information. They have free toolkits for educators that I frequently use, free toolkits for healthcare professionals. There's just so many great resources on there, so I highly recommend you check that out if you haven't already. There's a provider list, etc. And I did want to put this photo up here of this book. This is the manual, the parent workbook for CBIT. So if you are considering pursuing CBIT services, I do recommend that you purchase this book if possible. You can find it on Amazon or Barnes & Noble, or you can find it online pretty easily. And in this book, they'll kind of talk you through each session. They'll talk you through CBIT. There's some worksheets for your child to do. Yeah, so it's a really nice resource to have as well. All right, so let's say I want to pursue CBIT. How do I go about doing it? Well, there are two options. One of them, we have it here at the hospital, Children's Hospital Colorado. If you want to pursue it here, you can call the occupational therapy schedulers at 720-777-6611. When you talk to them, ask for CBIT treatment. And I have this bullet point on here for your own reference. Here at the hospital, outside providers, CBIT providers might bill differently, but we bill it as occupational therapy services. So if your insurance covers occupational therapy, it should be covered. There are also other Colorado CBIT providers available to you. Our wait list is usually around 6 weeks. It depends on your flexibility with scheduling as well. So if you want to pursue other Colorado CBIT providers, that's great. There are some great providers in the state of Colorado. So that's where you would contact the Colorado TAA at coloradotaa@gmail.com and ask for a list of providers for CBIT.